Hello, everyone. My name is Robert Witt, and I'm here representing Group 1 with Joseph Kunkel for Stanford Medical. I first would like to start with a little background here for Stanford Medical. They do have three divisions. They first have the University School of Medicine, which was founded in 1858 and is primarily used for research. They also have Stanford Healthcare, founded in 1903, which is their adult hospital. They also have the Lucille Packard Children's Hospital, founded in 1919 for children. And officially in 2012, under the one umbrella, they did unite under Stanford Medicine. Their mission statement and main focus is on cutting-edge healthcare to help people in need fastest and most efficiently with the latest and greatest tech. Competition includes other top medical schools and hospitals from all around the country, including our University of Cincinnati here in Ohio. The biggest part of this case is talking about what is EMR, and more importantly as well, what is the Flatiron system that we are talking about trying to implement here in the case. EMR stands for Electronic Medical Records. According to some of the Stanford CIOs, this is one of the main healthcare IT systems that are used on a day-to-day basis. These systems are designed to improve patient care as well as give access to the most up-to-date medical research. These things are very important because especially in this day and age, we want to make sure we get the most up-to-date patient research and medical research available to help our patients, as well as being able to keep track of that and avoid violating HIPAA laws. HIPAA laws were established in order to protect patient confidentiality. And the case goes into talking about how if any vendor violates HIPAA, it's not on the vendor's fault for making all of those adjustments. They're not getting investigated by the US government. It's the organization itself. So in this case, it'd be Stanford Medical. And so we want to, when looking at a EMR system, we want to make sure that it's not only going to be best and easy to use across the spectrum, but we want to make sure that it complies with HIPAA laws and is very secure in that aspect to make sure we don't have to go through a giant security audit. And a big reason the Flatiron system was looked at very well in regards to Stanford was because they have a degree of standardization. And we'll go into that here on the next slide. So as I said in the previous slide, we're going to talk about why we should implement this Flatiron system. The Flatiron system is based on standardization. So Stanford Medical has about over 800 different EMRs that could be implemented. Hundreds and hundreds get pitched to Stanford each and every year. And each system has to go through a rigorous process of being looked at by CIOs. And even a lot of them have come out and they've said how much they do love some of these systems, but it doesn't either work with some of their current systems or just isn't cost effective to go ahead and implement. The Flatiron system, though, is based on a standardized model with all of its partner institutions. So Stanford Medical could easily introduce this across all three aspects of its divisions. Again, so all three divisions could have this system and it'd be the same. The case does dive into how these systems are so different and how none of them talk to each other very well. So trying to come up with a system that is standardized is a lot easier said than done. And the Flatiron system does come ahead and offer that standardization for Stanford. Because of this standardization, they are quicker to set up than a lot of other systems. EMR systems can take years and billions of dollars to set up. Now, this is something that since they're so standardized, it wouldn't be as long of a process. With that being said, that means it will be a lot cheaper to go ahead and implement this system. That is something that in the medical field where things are changing so rapidly and so quickly, we want to make sure that our teams are doing. And being able to do that quicker will allow us to get back to saving lives there. So Stanford is really looking for something not only to be standardized and quick to set up so they can save money, not only to help their bottom line, but to further advance their goal of helping patients. It also gives access to the most up-to-date information from the Flatiron Network. All of these other research sites that Flatiron is in will be able to go ahead and share their data. Now, this all is heavily encrypted to not violate HIPAA. So there's no reason, again, Stanford is looking to not violate HIPAA because of all the laws. So they want to make sure that that data isn't being sent over with names or anything like that, but it shows people with similar cases. It can show someone who has a similar cancer diagnosis and what doctors are doing to treat it in various parts of the country. This is something that not only gets you real-time research right away, but it allows the doctors to think about maybe some more outside of the box options that they wouldn't have thought of right away. You can't expect a doctor to remember every diagnosis they're going to make and every treatment plan and know if something's not working. We need to make sure that we can communicate to prevent diseases from growing and making sure we're all on the same page. This also allows us to go ahead and implement and follow through on that mission statement of providing the most cutting edge care and up-to-date technology for all of our people. We want to make sure that we give them access to the right things there. In conclusion, I would like to talk about and show this chart from benefits from the case showing Exhibit 9, which talks about other benefits of an EMR system, in addition to the ones I talked about for standardization. I'd like to thank you so much for your time and have a great rest of your day. Thank you so much.